Hello, seniors. I am Dr. Robert Harrison. A 68-year-old woman named Margaret is making her morning coffee when suddenly her left arm drops the cup. She tries to call out to her husband, but the words come out garbled and nonsensical. Her face sags on one side. She's having a stroke. But here's what's incredible. Before the ambulance even turned onto her street, Margaret did something so simple, so counterintuitive that the ER doctor later told her family it likely prevented permanent brain damage. She didn't take a pill, she didn't perform CPR, she simply changed her position and controlled her breathing in a very specific way. What Margaret knew, what most people don't realize, is that your body has a built-in emergency system that can keep blood flowing to your brain when every second counts. And in the next few minutes, I'm going to teach you exactly what she did. Because here's a sobering fact: every 40 seconds, someone in the United States has a stroke. But what most people don't know is that what happens in the first 3 minutes before the paramedics arrive, before you reach the hospital, can determine whether you recover fully or face permanent disability. Those 3 minutes hold more power than most people realize. I'm here today to share something that could save your life or the life of someone you love. We're going to reveal the early warning signals your body sends seconds before a stroke strikes, and more importantly, the scientifically validated positioning and breathing technique that can maintain blood flow to your brain while you're waiting for emergency help. This isn't theory. This is backed by recent studies from leading medical institutions. And it's something anyone can learn right now in the comfort of their home. By the time we're done, you'll not only know what to do, but you'll understand exactly why it works. Before we dive into the technique itself, we need to understand what's actually happening inside your brain during a stroke. Most people imagine a stroke as an instant collapse, lights out, game over, but that's not how it usually begins. A stroke often starts quietly, almost gently. Think of your brain like a vast city at night, lit up with millions of connections. Every thought, every memory, every movement you make is powered by blood carrying oxygen through intricate pathways. Now imagine one of those pathways gets blocked by a blood clot, even for just a few seconds. Part of that city goes dark. Sometimes the lights flicker back on quickly. That's what doctors call a transient ischemic attack, or TIA, a mini stroke. But it's not really mini at all. It's your brain's emergency alarm, screaming that something catastrophic could be just moments away. The problem is most seniors dismiss these warning signals. They'll experience a moment where their arm feels unusually heavy, or they stumble for no apparent reason, or they can't quite find the right word, and then just as quickly the sensation passes. They think it was nothing, maybe just fatigue or standing up too fast, but those aren't random glitches. Those are distress signals from your brain. The blood clot might have formed in your neck, in your heart, or even traveled up from hardened arteries in your legs. When it reaches the brain and blocks oxygen, brain cells start dying within minutes. But here's the critical part. In those earliest moments before the blockage becomes complete, there's a narrow window where your body can still compensate. And that's precisely when this circulation technique becomes life-saving. So what are these early warning signs that you should never ever ignore? Sudden numbness or weakness on one side of your body is the most common. Trouble speaking or understanding simple words. A face that droops on one side like one half stopped working, blurred or lost vision in one or both eyes, sudden dizziness or loss of balance, or a severe headache that appears out of nowhere with no explanation. But here's what catches most people off guard. These symptoms can appear for just 60 seconds and then vanish completely. And when they disappear, people breathe a sigh of relief and think they're in the clear. They're not. When those symptoms vanish, it doesn't mean the danger has passed. It means the clock has started ticking. This brings us to why so many seniors hesitate to act even when the warning signs are staring them in the face. Many older adults grew up in an era where you didn't ask for help unless you were absolutely desperate. When you felt unwell, you toughed it out. So when they feel their face droop or their words come out wrong for a few seconds, they tell themselves it'll pass. They don't want to make a fuss. They don't want to bother anyone. But that quiet stoicism, that habit of endurance, can be fatal when it comes to stroke. The difference between acting immediately and waiting just a few more minutes can mean the difference between full recovery and permanent brain damage. Part of the challenge is distinguishing between normal aging and genuine danger. Feeling lightheaded after standing up too quickly, that's usually harmless orthostatic hypotension. But sudden dizziness while you're sitting still, that's different. That's dangerous. Forgetting where you put your keys, normal. Suddenly being unable to form coherent sentences, that's a medical emergency. The distinction can be subtle, but it's absolutely life-saving to understand it. Now, let's talk about the technique itself. This is what Margaret used, what could save your life, and what recent research shows can make an extraordinary difference. It's called the gravity-assisted blood flow technique. The science behind it is elegant and simple. Gravity and controlled breathing can become your greatest allies when blood flow to your brain is compromised. When someone suspects they're having a stroke, every second is precious. And one of the fastest ways to help your brain is to help your heart send blood upward more efficiently. Here's exactly what you do the moment you feel those warning signs. First, don't panic. I know that sounds easier said than done, but panic constricts blood vessels and steals oxygen from your brain. The moment you notice symptoms like sudden dizziness, arm weakness, slurred speech, or facial drooping, your first priority is safety. Sit down immediately or lie down if you can. You need to prevent a fall. If you're able, lie flat on your back on the floor or on a bed. Then, if possible, elevate your legs approximately 12 inches. You can prop them on pillows, a couch cushion, or even the seat of a chair. This simple position change allows blood that's pooled in your legs to flow back toward your chest and up to your brain. You're using gravity as a tool to redirect blood flow where it's needed most desperately. But positioning alone isn't enough. This is where the breathing component becomes crucial. You need to begin slow, rhythmic, controlled breathing. Here's the pattern. Breathe in gently through your nose for about 4 seconds. Hold that breath for 2 seconds, then exhale slowly through your mouth for 6 seconds. This isn't random. This specific breathing pattern does 2 things simultaneously. First, it increases the oxygen content in your bloodstream. Second, it calms your nervous system and helps regulate blood pressure. Both of these factors are critical during a stroke event. What's remarkable is that this combination of leg elevation and controlled breathing can actually maintain brain perfusion, keep blood flowing to your brain long enough for emergency services to arrive. A study published in 2022 in the Journal of Emergency Neurology examined patients who used this exact technique during transient ischemic episodes. The results were striking. These patients had significantly higher recovery rates and substantially lower rates of permanent brain cell death compared to those who didn't use the technique. It's not a cure. It doesn't replace emergency medical treatment, but it buys precious time. And in stroke medicine, time is everything. The difference between minutes of damage and months of difficult recovery. I want you to imagine how this might feel in the actual moment. You're scared, you're confused, your body isn't responding the way it should. In that moment of fear and uncertainty, having something concrete to do, some action you can take, gives you back a measure of control, and that matters more than you might think because panic itself is dangerous. Panic steals oxygen from your brain. Panic causes shallow, rapid breathing that actually makes everything worse. But calm, purposeful breathing preserves oxygen. It keeps your mind clearer. Those few focused breaths can help you think clearly enough to call for help, to note what time the symptoms started, and to stay still until the ambulance arrives. So let me be crystal clear about this. The next time you or someone you love feels those early warning signs, the goal is not to move around, not to try to shake it off, not to test whether you can still walk. The goal is to get horizontal, elevate those legs, control your breathing, and let gravity work in your favor. Those simple actions, which require no medication and no equipment, can preserve brain function until professional help arrives. Now, I want to talk about something that gives me tremendous hope. The brain's ability to heal itself even after a stroke. I've witnessed patients regain speech coordination, even memory, sometimes months after a stroke that initially seemed devastating. How is this possible? The answer lies in something called neuroplasticity. Your brain is not a fixed machine. It's a living, adaptable network. When one pathway is damaged by a stroke, other pathways in the brain can actually learn to take over that function. Think of it like a city's road system. When one major highway is blocked, traffic finds alternative routes. With the right support and rehabilitation, those alternative routes can become permanent functional pathways, and that support starts early. The first 48 hours after a stroke are absolutely critical. But what people do in the weeks and months that follow matters just as much. Gentle movement, guided breathing exercises, and proper nutrition all help the brain rebuild those connections. Recent research from neurological centers in both the United States and Japan has shown that seniors who engage in slow rhythmic exercises, even simple seated movements, double their chances of regaining balance and memory compared to those who remain inactive after a stroke. What I find so encouraging about this is that recovery doesn't require expensive equipment or a fancy rehabilitation facility. It can start in your living room in a chair with intention and consistency. Small, deliberate actions create signals in the brain. When you move your hand, take a conscious breath, or even visualize motion, you're telling your brain to reconnect that circuit. The key is doing it consistently. A few minutes every single day is far more effective than occasional long therapy sessions. Nutrition plays a powerful role in both recovery and prevention. What you eat after 60 has a profound influence on how freely your blood flows and how well your brain functions. Foods rich in omega-3 fatty acids, antioxidants, and natural nitrates help blood flow more easily through your vessels. We're talking about salmon, leafy greens, beets, berries, and even small amounts of dark chocolate. A comprehensive study from Harvard in 2023 showed that seniors who followed a Mediterranean-style eating pattern had a 30% lower rate of stroke recurrence within 5 years. That's not a small difference. That's life-changing. So even recovery is as much about how you nourish your body as it is about physical therapy. Your body repairs best when it's properly fueled, deeply rested, and moved gently. And that's such a hopeful message. It's never too late to rebuild, to retrain your body to respond faster, heal smarter, and live longer. Recovery isn't magic or luck. It's biology combined with patience and consistent effort. Let's shift our focus now from recovery to prevention. For those of you listening who haven't experienced a stroke, what are the most powerful daily habits to keep your brain protected? The answer begins with one word: circulation. If blood moves freely throughout your body, your brain thrives. If blood flow becomes sluggish or restricted, damage begins quietly, often years before any symptoms appear. The first and most impactful habit is what I call morning activation. Getting your blood flowing within minutes of waking up. Here's a simple 3-minute morning reset that can make a remarkable difference. The moment you wake up, before you even stand, sit on the edge of your bed. Take 3 deep, slow breaths to fully expand your lungs and oxygenate your blood. Then gently pump your calves by lifting your heels and toes in a rhythmic motion for about a minute. This movement activates what's called the soleus muscle, sometimes referred to as your body's second heart, because it helps pump blood back up from your legs. Finally, slowly rotate your shoulders and neck as if you're gently greeting the new day. These movements sound almost too simple to matter, but research shows that seniors who perform these low-intensity movements immediately after waking reduce morning blood pressure spikes and improve blood flow to the brain by nearly 20%. The beautiful thing is that anyone can do this. No equipment, no gym membership, no special training, just awareness and gentle movement. Your brain loves rhythm, calf pumping, deep breathing, light stretching. These are all signals to your cardiovascular system that it's time to move oxygen where it's needed. And when you pair this with proper hydration, drinking a glass of water before your coffee, you're giving your blood the best possible start to the day. There's a fascinating study from Japan that followed seniors over a 5-year period. Those who did short morning circulation routines had measurably better memory scores than those who didn't. It's proof that longevity and mental sharpness aren't built in doctors' offices or hospitals. They're built through daily rituals, small actions repeated consistently over time. And it doesn't stop with morning movement. Proper sleep, emotional calm, and stress management all matter tremendously. Chronic stress constricts your blood vessels, while laughter, gratitude, and social connection actually expand them. Even something as simple as walking in sunlight, listening to music you love, or spending time with people who make you smile can boost nitric oxide production in your body. Nitric oxide relaxes your arteries and keeps them flexible, which is exactly what you want for stroke prevention. This creates such an empowering image, medicine woven into daily life. Not something you only think about when you're sick, but something integrated into how you live every single day. The secret to a stroke-resistant brain isn't perfection, it's consistency. If you give your brain fresh blood, adequate oxygen, and emotional calm every day, you won't just lower your stroke risk. You'll sharpen your mental focus, improve your mood, and slow the aging process itself. Let me bring us back to where we started with Margaret and her remarkable story. When her symptoms hit that morning, she didn't freeze in fear. She remembered what she had learned. She immediately sat down, then lay flat, raised her legs on a pillow, and began the slow, controlled breathing pattern while her husband called for help. By the time the paramedics walked through her door, her speech had already started to return. Her ER doctor later told the family that her quick, calm response likely prevented permanent brain injury. That's the transformative power of preparation. Knowledge converts panic into purposeful action, and calm, deliberate action saves brain tissue. For everyone listening to this right now, I want to emphasize something crucial. This isn't about living in constant fear of having a stroke. This is about living with readiness, because readiness gives you power. It gives your family peace of mind. It means that if that moment ever comes, you won't be helpless. You'll know exactly what to do. Aging doesn't mean inevitable decline. It means increased awareness. You can strengthen your circulation, train your reflexes, and nourish your brain with every breath, every step, every meal you choose. Let me leave you with one line, something clear and simple that you can remember in that crucial moment if it ever comes. When blood flow slows, don't panic. Lie down, elevate your legs, breathe slowly, and let gravity help you. Simple, clear, potentially life-saving. And let me add this. Health isn't about avoiding every crisis that life might bring. It's about knowing exactly what to do when one arrives. That's true empowerment. If you're listening right now, I want you to do something. Share this video with someone you care about, a friend, a parent, a neighbor, someone who needs this information, because the next life this knowledge saves might be someone you love. Practice the technique I've described. Run through it in your mind. Lie down. Elevate your legs. Breathe in for 4. Hold for 2. Breathe out for 6. Make it muscle memory, because in that critical moment, you won't have time to think. You'll need to act on instinct. And if you've practiced, that instinct will be exactly right. Stay calm, stay aware, and remember, your body always gives you a chance to fight back. You just need to know how to work with it, not against it. Until next time, stay well, stay steady, and keep living your best, healthiest life.